All right. Hey, welcome back to the Go for CEO channel. This is John the Bomb. Building others means business. And once again, I'm bringing you a pretty stellar and incredible business. All right. This gentleman, I actually knew him from a former entrepreneur position that I had back in the day. And we just stayed friends. We have Colombian roots, right, from our motherland of my mom and his parents and stuff. And then he joined up with a gentleman with, I also have roots in the Puerto Rican side with Dr. Randy. So we've got the pleasure of having Dr. Randy and Edgar, my guy from Spot. I totally messed it up. Med La Vie. Hold on. Give me 1 second. Let me start that again. All right. Hey, welcome back to the Go for CEO channel. This is John the Bomb. Building others means business. And I've got another great opportunity, Go for CEO community. You're going to learn a startup phase opportunity here in an incredible industry. And these two gentlemen are really rocking the industry right now. So Edgar and Dr. Randy, both Latinos, so I have Colombian roots and Puerto Rican roots. And both these guys come from those backgrounds. Super excited, had built a relationship over the last few years with Edgar, and now getting a chance to know Dr. Randy as well. We did a little talking offline, but you're going to enjoy this episode. So Dr. Randy and Mr. Edgar, how are you from Med La Vie?
Doing well. Thanks for having us on.
Awesome, guys, man. Well, hey, look, I know that you bring a various amount of experiences to this opportunity. But on the Go for CEO channel, we just love learning about, how these CEOs, founders think of these, the entrepreneurs of these businesses. So the ideation phase is always a big one. And obviously what you're doing to revolutionize the industry and what you're doing, how you're going to make a mark in this business. I know that over the last few months, you really started to kind of ramp up. You're getting some social media presence. I saw, Edgar, your awesome video, and I got a chance to repost that. So why don't we tell the audience a little bit about the background, how you guys got together, and where the idea came from for Med La Vie.
All right, so the idea for Med La Vie, it's a mobile IV company as well as weight loss and skincare, pretty much based off of IVs. And the reason it came to be is we're based out of Miami, Florida. And, we all went through the COVID experience where we all got locked down, and a lot of things happened to a lot of businesses grew from like the convenience of doing things within people's home or office. So a lot of people before in Miami, we party a lot down here. And I would hear about a lot of people getting these hangover drips. They would go to like these IV places, get hangover drips. And I thought to myself, like a lot of people got used to working from home and the convenience of being in their home office or wherever it may be. And they just don't want to go to physical locations anymore. So we thought, why not do mobile IVs, and that way they don't have to leave. They can continue working. If they're hungover or whatever it might be, they could stay in bed and just get cured like that within an hour. I had that idea. I brought it over to Randy, who is a medical doctor and a medical director for a hospital down here. And, he liked the idea and we teamed up and now we're running with it.
I love it. And look, a lot of times it's out of convenience, it's out of solving a problem, it's out of things that are going on in our community that you could create a business. So tell us, a little bit about, I guess, how you guys connected, right? Obviously, you bring this idea to Randy. You guys kind of think about it. What's some of the initial steps that you say to yourself, okay, hey, this is viable. This is something that we can go to market with?
Well, it seemed to make sense because considering his network of contacts being in the hospital and in the medical fields, and I just had the idea, and I also have a network of people that, would have a need for our services. It seemed right for us to team up, considering he'd have the background on, finding the nurses, having the know-how of the medicines to use, being pretty much the quality control behind what we're backing up in our business. That all made sense. And then aside from the fact that, I have a networking with my background in entrepreneurship and just the way that I go meet people to, expand this business on the front end.
Nate. So Dr. Randy, did you just think that this guy was crazy, or what'd you think when you first heard the idea?
No, it's something I had thought about in the past as well, but it's always easy when you have someone who can help support you and help you grow the business, so that you're not trying to do everything alone. So when you have the right people and you put them together, it's easy to do these things and accomplish better things.
And look, partnerships are not easy, right? So I don't have to tell you that. I'm sure that there's been days, right? You're like, no, I want to do this. No, I want to do this, right? So tell us a little bit about the dynamic, right? I think it's a good segue to think about what made you guys think, or what were the strengths and weaknesses that you could complement each other with from your perspective.
All right. So the strengths were, I feel like we're both pretty clear communicators. I mean, that's key in any relationship. I feel like there has been times when we've had differences, but I don't think this ever turned into any sort of conflict. Compromise as well in a partnership is obviously one of the key components to a healthy relationship. So far, we just obviously, we have our ups and downs as far as where we want to be as far as momentum goes. But as long as we keep on pushing, and we persevere through the struggles that we have in any startup, I'm confident that we're going to blast off the way we intend to.
Nate, and tell us, that's part of the startup struggle is, finance, it's marketing, it's, how to streamline your operations, how do you start to be able to bring in good talent, right? So tell us a little bit about maybe one of the areas that you felt like initially may have been kind of sputtering along, but now you've started to build a little bit of momentum and you're starting to see, an area in your business that you really are building some good momentum in.
Yeah, I think like you said, having good people around you as well. So as Edgar was mentioning, just the staffing, right? We're providing a service that we have a certain look, a certain feel, and what the clients expect. So anybody could do, an IV. Any nurse who's put an IV in the past can do it, but this is a concierge type service. We're going into people's homes. We're being invited into their world. So having the clientele that we're servicing, you definitely want staff that is both capable and also understanding of what they're doing. It's a different beast than being in a hospital, being in an urgent care where someone's coming to you and you're just doing the service you normally do. We're putting them in a different situation where they're going into the comfort and privacy of their own homes, respecting, their personal space and providing that concierge, high-end luxury type feel. So definitely getting the right staffing, making sure they understand the concept of what we do, what sets us apart from others, and where we're trying to go with this. So not everybody's the right fit for us to utilize, even though they might have the background skills to do it. It's more than just that. So we've definitely created a good team around us that they understand that. And so far it's been well.
So let's go a little deeper on that, right? When you say the team, obviously you two gentlemen, the idea, the concept, the name that you put out there, the services that you have, what were some of the dynamics of recruiting some of the people that are working with you? And are you personally also going out there in the field? What's the dynamic of that service end of it?
So Edgar's gone to a couple of appointments as well, especially in the very beginning, just to kind of quality control as well. We've done a lot of trainings with our nursing staff so that they understand. We've gotten drips ourselves and used the products ourselves and been kind of guinea pigs. So we wouldn't put anything out there that we wouldn't feel comfortable having ourselves or giving our family members, and even with the same staff that we're sending out. So most, if not all of our staff have had to put IVs in either Edgar or myself so that we can quality control that. So Edgar has gone out to several meetings. I usually will do a telehealth visit, kind of run through the medical history with our clients beforehand to make sure that what they're getting is appropriate for them and there's no contraindications and there's no concerns, even though most of everything we're doing is natural. There are certain instances where, it wouldn't be appropriate for them. So we both have a lot of hands-on activity within the business and our clientele and when they're getting our services.
Nice. Anything else I've heard to add to that?
As far as the
team profile, the things that you've had to do to kind of be in the field, learn some of the standard operating procedures, those types of areas.
No, yeah. So as long as I'm present, because obviously I'm not a doctor per se, nor a nurse. So I like to be in there so that when I do go to the appointments, obviously I like to go to the appointments to make sure that everybody knows about the other offerings that we have as far as Med La Vie goes, aside from mobile IV, and obviously to make sure that if something is happening in front of me, I'm aware that it's not the correct procedure and I can pull that nurse to the side or whatever it might be. I don't want to be just ignorant to the whole process. So I kind of vicariously am learning a lot about the medical industry, which is great. You know, it's another way for me to sharpen myself up. So I'm intrigued by the entire thing. I'm very passionate about it, and I think our team is as well. We've selected a very strong, personable staff that can upsell, can be informed or pass on the information on to our patients, and we're really happy so far.
Nice, nice. And so what's the structure at the beginning here? Has it been 1099 contractors? Have you brought on W-2 employees? What are you guys doing to kind of mitigate, obviously, cash flow with paying your people? How does that structure work for you at the moment?
Everybody's 1099 as of right now. We don't have anybody on salary just yet, as a lot of the admin stuff we are handling right now as we grow. But obviously, as it becomes too much to handle, that is obviously something that's on the roadmap for us, to have salaried employees to take on some of the workload that we're currently handling ourselves.
Nice, nice. Now let's transition into marketing. You know, a lot of people on the Go for CEO channel love to hear kind of a small, medium-sized business, right? Especially startups. You know, where do you put your dollars? How did you concentrate from your clientele on the barber side to your clientele on the medical side? What are some ways that you're attracting people to be a part of the service? And is a lot of it word of mouth, organic? Are you putting a lot of dollars into ads? Are you doing, old school, just knocking on doors, working with people, maybe club promoters, those types of things? How are you going into the marketplace from a marketing perspective?
Well, a lot of the things as far as marketing goes, you have to take into account the season, right? So we're in South Florida and it is summertime. A lot of our money right now is going into digital marketing as far as weight loss goes. So a lot of people want to get fit for the beach. We have a lot of ads out there right now for marketing. The bulk of our marketing is geared toward weight loss right now because that's the season. We're getting a lot of leads as a result of that, a lot of meta ads. It's pretty much all going into Facebook, Instagram meta ads. And we're getting a solid amount every single day to call on and set appointments for. Aside from that, we're also, spreading the word through our regular network. I have a display case at the shop that I currently work at. Randy has a display case of our skincare products at his office as well. So these are all conversation starters as far as spreading the word. Any testimonies we have, we also try and blast it on social media as well, so the world knows that our products do work. And it's just a matter of getting exposure, because I know we have a great product line, and once the world realizes it, I'm sure it's going to sell itself.
Sweet, sweet. So look, obviously you talked a little bit about how you initiated the concept, came together as a partnership. You also have shared a little bit of the team and who you decided to work with, right? As a 1099 contractors right now that can, represent your brand. And now you've shared a little bit about the marketing. So how about funding? That happens to be my world. I'm in the acquisition finance space, equipment finance, SBA lending, all that type of stuff. And I'm always interested, how companies start. Could it be bootstrapping, right, with just your own credit cards or lines of credit, those types of things? Or did you have investors that have come aboard, obviously with your doctor network or your barbershop experience? And I know your wife is in the finance space as well, Edgar. So tell us, the community, how did you finance this initial launch, and what were some perspectives of bringing in possibly investors or things that you've been able to do?
All right. So initially, everything is happening out of our own pocket, but on the roadmap, the goal is to lay down the foundation and to be able to franchise this model. So basically, we did a lot of legwork, our main focus was primarily on having a very attractive website, a very easy to use website, one that was informative as well as user-friendly. So we spent a lot of time on that. We spent a lot of time on the back end, backing up our name, trademarking our logos, protecting us as far as all the legalities that we could think that we could possibly face in the future. But yeah, a lot of that has been just our own sweat equity and coming out of our own pocket right now. But obviously later on, as we continue to expand and gain traction and gain exposure, we're open to investment opportunities if anybody wants to invest.
So Randy, I'd love to hear from you, from a partner perspective. You've been in the medical field. I don't want to assume, have you owned a business before? Or is this your first venture as an entrepreneur?
No, I have my own medical practice. I have my own clinic. I'm a board certified family medicine physician. So I do primary care. I have my own practice there. I work in the hospital. I do multiple different things. So this is just another venture that we're going out on together.
I love it. I love it. And look, I do equipment, I'm sorry, not equipment, but practice finance around the country as well. So I deal with a lot of doctors, and it's interesting, sometimes doctors can be accused of not being very business oriented. Sounds like you have that capacity. And look, it's awesome to see, that you guys have put this thought together and now put it into action and into the marketplace. When you say franchising, over the next 6, 12, 18 months, what does it look like to perfect your standard operating procedures and the way that you're operating your business so that you can then model it as kind of a franchise opportunity?
Yeah, I think similar as you were kind of saying, a lot of physicians, we spend so much time in the books learning medicine, how to take care of people and how to do the right things. There aren't financing classes in medical school. And you're probably unlikely to be taking them when you're in your undergraduate as well, because you're focused on biology, chemistry, and all the other things that set you up to be able to learn the things in medicine. So that's where that comes from, really, and it's not untrue. So as Edgar and I had talked about, it'd be nice to get to the point where once we have a well-oiled machine, everything is set, we have certain procedures in place, that we can bring this out to other physicians that would otherwise want to do it, because a lot of physicians would be capable of doing this business if all the legwork and the sweat equity that Edgar mentions is done and provided already for them. I've already had several physicians, people that have trained with me and said, hey, this is a great model, this is great, but they don't necessarily have the know-how or the desire or the will to kind of get it to that point. So a lot of physicians would be able to kind of plug and play this once we get to that point and we have everything structured the way that we need it to be, and be able to train them on how to kind of take this model that we've created once we get to that point.
I love it. I love it, man. Look, obviously setting a standard, putting together a business that now has operations, marketing, and almost a business in a box per se. You can then market it to those industries, right? And it could be doctors, could be other facilities, other entrepreneurial type people, right? And even a co-branding we could do in the future with Go for CEO and some of the people that we bring on that want to become entrepreneurs and CEOs and founders of companies. So look, we've gone through a bunch of different areas of the business. I know it's only a few months old as far as the concept and the launching of it in May of 2023. What are the next 6 to 12 months looking like for you guys as far as just where do you want to concentrate on? Is it client base? Is it a spread of marketing in Miami and being like the go-to IV plus the other services business? Where is it that you guys are thinking these next 6 months you really need to concentrate in?
Well, the main focus in the next 6 months is for sure building the brand and getting exposure. As we continue to build into people's subconscious, the more we're spoke about, the more we're thought of when it comes to either mobile IV, skincare, or weight loss. If we can, those are 3 huge segments in any space right now that are very lucrative. So if we can get our hands on that and obviously automate everything so that we can streamline to be able to franchise. I mean, if we can be able to franchise a year from now, that'd be an ideal goal of ours.
So when you say that, and I just caught that, so I want to be particular into going deeper on this. You said obviously the IV part is kind of hit a certain sector of the market, and that after club experience. But then you said weight loss and skincare. What are some of the products did you guys develop, or are you distributing through other manufacturers that you've been able to build relationships with?
Yeah, so there's a lot of IV companies that do similar to what we do. So what our slogan is feel better, look better now. We've trademarked that as we've done our logo, our name, and everything. The idea that we came up with and to kind of separate us and what we thought provides a more comprehensive clinical or more comprehensive experience for a client or a patient is not to just go out there and, as I mentioned, just have a nurse go and provide a drip and okay, see you, thank you, we'll see you next time. It's more about to provide a service that can kind of help you with everything, the inner and the outer. So obviously the drips, there's drips there for anything you like. We have custom drips where we can draw labs and tailor it to your specific values. A hangover drip or something as simple as just regular plain hydration with nothing in it. But while those things may help you feel better, we said how some of them also have a component to where they can help you look better. boosts collagen, which helps with skin and whatnot, we thought to ourselves, how can we kind of expand upon this? How can we kind of take it to the next level? How do we identify differently from the next guy that's doing this as well? And the other thing was to kind of do the outer side. You know, the skincare came into play because the drips, we have a drip that is for skin and nails. So it has like biotin and other features in it that help with, healthy hair, healthy nails, and just kind of glowing skin. So if we could provide this kind of complete package where we have a drip that targets that, but then we have high-end quality skincare products that also help with this, you're only kind of compounding on that process and kind of getting you quicker to your goal. So that was kind of the thought behind it. We have manufacturers that we distribute their products that we kind of white label essentially. We were very meticulous about who we worked with. Like I mentioned earlier, I'm more than happy to be a guinea pig. Anything and everything that is offered through Med La Vie that you see on our website has either gone in my body, on my body. I've used all the skincare products. I've used the weight loss products myself. I've done all the drips myself. So there's nothing that we provide that I haven't wanted to use on myself and make sure that I was happy with. It provided the results that I was looking for and we were looking for, and that it was safe. Ultimately, we've given it to a lot of other clients before, we are friends and family, just to kind of try these things. It wasn't say, hey, let's just find some skincare and do it. We went through different companies. Not everything we tried, we liked or was appropriate for where we wanted to go. But what we ended up with was a product catalog that is very high end. Most of the people that have tried it are pretty much exclusively using it. Even my wife, I mean, she doesn't, it saves me a lot of money now too, actually. She doesn't go out to Sephora or any of these places to buy products. I mean, she uses our products. She loves them. Her skin looks great. She gets compliments all the time. So is that combination of trying to create this whole package. And then the weight loss just kind of fell in line too, especially with the times right now. There's medications on the market that are booming. So as people are losing weight, that's also both making them look and feel better. So it was this package that we were able to put together that we think sets us apart from other companies that are maybe just sending out nurses to do a drip and call them when you need them. But we want to be here to kind of help you with that entire package in and out.
That's amazing, man. You really hit kind of a lifestyle brand, right? That
Yeah.
could really be a part of someone's everyday as they think about not only going out, coming back, recovering, but being your daily life from the skincare to the dieting side. So really awesome stuff, man. I'm super excited over the next 6 to 12 to 18 months to bring you back on the Go for CO channel and really kind of see where you guys grow, how you get into the marketplaces and move on from the Miami, setting a base there to then moving, obviously, either expanding in Florida or nationwide. So, all right. So look, one of the ways that we end the Go for CEO interviews is CEO. So client experience, engagement, and operational excellence. So the client experience is obviously huge, right? You have a personal touch. You're, like you said, you're in their home. They're inviting you in, and they're taking your service as something that they want to benefit from. So what are some of the maybe 2 or 3 points that you do to make a difference in the client's experience?
All right. Well, first off, the client experience is everything. So we definitely believe in personalized experience. We've ran mock trials before we went out to market on how it was going to be with personal friends of our own and to get their feedback on how we can improve. So we gather that feedback and we make sure that everything is as comfortable as it could possibly be for the client. From the moment they sit down, making sure they have a cup of water ready, make sure that they're aware of how they're going to feel during the process, what that particular IV might do to them, if they feel any sort of whatever feelings they have, to communicate that with the nurse, so she can either slow down the drip or speed up the drip. What they need to do if they need to use the restroom during the process. All this explains to them beforehand so that they're well aware and there's no confusion during the process. We want to make sure they're very comfortable, and then obviously that they would want to repeat, since we do have membership services, and we'd like those clients to be recurring of ours. So those are things that we all touched on to make sure that the customer has the best experience possible. And then we're obviously we're constantly gathering feedback as well on how we can improve the experience from our current clients as well.
Nice. So do you do maybe like surveys afterwards? Is there a pamphlet that they fill out as their experience, or how are you gathering that data?
Yeah, so a survey is emailed to them for feedback. And and anything that they want to input. And obviously, if they have good feedback, then we do offer them the opportunity to write us a 5-star review on Google, as a way to close off the segment, to obviously gain us our exposure on Google as well. So those are some things that we're doing.
I love it. I love it. Yeah, look, client experience is one of the really the drivers of any business, and how that client then is able to then market it to their friends, right? And say, hey, what a great experience. Maybe the way that you made them feel, obviously it's a beautiful touch. So great work on that. How about engagement, right? Engagement could be, the 1099 contractors that you have, the manufacturers that you work with from some of the product lines, the vendors that you work with on other things, from IVs to all that. How do you treat engagement? Do you involve your team with parties? Like, do you get to know people through different ways? What are some of the ways that you engage with all the people in your business?
All right, so I guess as far as engaging with our employees right now, we engage with them as far as communicating the appointments and how we want everything done. So far, we haven't been able to throw any parties just yet, considering we're so new. But the biggest focus right now, I would say, is client engagement. Make sure we respond to all the comments that we have on our social media posts, making sure that we ask the clients or our social media following what they want to see next, do a Q&A. We're going to do live stories soon, as far as like doing maybe, glam days in which we're testing out our products ourselves, inviting the audience to maybe come and partake in these glam days and trying out the products with us. And and those are the type of things that we're trying to engage right now, because right now, as we present things to the market, we want to make sure that it's what the market wants. So how do we engage with them? And that's going to be everything that we do is geared toward what our current target market is looking for. So we're constantly trying to engage with them. That's our biggest focus right now as far as engagement.
I love it. Anything to add on that, Randy?
Yeah, I mean, I know you mentioned like parties and things. Most of the nurses we have, I know them personally, whether I've worked with them in the hospitals or elsewhere. And we've done a lot of mocks. We've done a lot of meetings where we're kind of engaging them, as I mentioned earlier, to really understand what the brand is, like you were mentioning, like a lifestyle. It isn't just, hey, I'm sending you to this house, do this drip, and you get your 1099 at the end of the month. So we did a lot of it. A lot of people that started, we didn't decide to retain. So we definitely kind of weeded through and made sure that the people we had, they were buying into it and understood. So there was a lot of engagement there with these nurses to make sure that we had the team that we have now and can grow on it as we kind of get larger and busier.
I love it. Well, look, you guys both have experience running practices, running businesses. So as this new partnership flourishes, you're going to see different ways to really kind of engage the audience, engage your vendors, engage the people that you work with, right? So pretty awesome stuff. So the last one is operational excellence. And a lot of times, the glory is really in the sale, right? And having a client and they pay you and wow, you made a sale, that's great. But how do you streamline things? How do you have standard operating procedures? What softwares are you using? How do you make sure that your supply chain from the vendors that you use, the manufacturers, that they stock the products and they can ship them out, however you do your process. So give us a little insight on your operations and what you've already noticed in the first few months of from appointment setting to, delivering a product, those types of areas.
All right, so as far as appointment setting goes, everything we try and do through the website, we try and encourage that. If not, we have a direct line. They can call us and we can walk them through it, because obviously we cater to people of all ages. So sometimes we have an older audience that's not so tech savvy. I'll walk them through. As far as getting product to me, obviously we sell skincare as well. We have a relationship with our shipping company in which we could ship anywhere in the country. And we have a platform that we use for that. As far as social media, that's probably been proven to be the biggest obstacle, since it's a new day and age. Social media is huge. So we're currently using 3 different platforms on free trials to figure out which one is going to be the best for automation, as far as just setting up a schedule one day for the rest of the week, and then just having those blasts come out all like at particular times based off the research that we've done on when we should post. So it's a lot of trial and error right now, considering how new we are. But yeah, the whole key, considering that we want to franchise this in the future, is to figure out how best we can automate every single aspect of this vehicle, you know, like, so that's what we're trying and error on right now. There's no one platform that's going to do every single service. So we just try and figure out where we're finding a void and how we can automate that and streamline that a little easier for the next people that are going to invest.
Love it. Oh yeah. I mean, look, to create a franchise, you have that almost that cookie cutter mentality, right? Making sure that you can give a business in the box, that they can operate it, and they have that support from the main corporation or the main franchisor to be able to help those franchisees. So awesome stuff, Edgar. I know that Dr. Rainey had to step out for a second here, but you know, what are some of the things that you want to share to kind of end the story here as far as, and obviously we'd love to have you on 6, 12, 18 months from now, follow the progress, build a tribe around Med La Vie and everything that you and Dr. Rainey are doing. What are some of the places that they can reach out to you? Websites, like you said, social media, what areas can people interact?
Yeah, you can follow us on Get Med La Vie. That's the name on Twitter, Facebook, and Instagram. You know, our number is also on our website if you need to contact us there. I'm sorry about that. Yeah, so Get Med La Vie is our social media is www.medlavie.com is our main website where you can find all the information as far as all of our offerings, weight loss, skincare, all the mobile IV drips. Very informative, tells you every single thing that's in every single product. And obviously we're going to be adding onto the website. We're going to put testimonies up as they come in. We're going to have short videos on there explaining the difference between, let's say, a common question is tirzepatide versus semaglutide. We're going to be adding that on there soon. So it's constantly evolving. I can encourage everybody to check out the website daily as we're constantly making changes. Any feedback is welcomed as well. We're going to create a blog site on there as well soon for anybody who wants to put any input as to what they see and how we can improve or what they want us to add on. So, I mean, right now we're open ears on how to expand and what the market is looking for.
Well, I love it. Look, as a guy that finances businesses from startup to acquisition, it's really neat to, over the next 90, 60, 90, 180 days, you know, 9, 10 months, to check back in with you guys and see kind of where you're at, where the progress has been, and what learning curves have you been able to learn from. So anything else from you, Dr. Rennick?
No, I mean, like Edgar says, we're excited to expand, keep working, really educate also clients. We're trying to provide a lot of educational stuff as well. So it's not just promotional here, buy our service, buy this, but also educate our clients so that they understand what it is that's out there. There's also a lot of misinformation sometimes, especially as medicine is always evolving. There's new medications on the market. So definitely to educate, make sure we have clients that know what's going on.
I love it. Well, hey, Med La Vie, ladies and gentlemen, Go for CEO community, visit the website that Edgar shared. You know, give these guys a try, especially if you're in the Miami, you know, area right now. They're growing from there. They're just starting up over the last 3-6 months, right? It's not just been that they just launched, right? They put thought into it. They put research into it. They put data into it. And then they put a partnership together to really do something big. So excited to see your future growth and success. So thanks for visiting the Go for CEO channel, guys.
Thanks for having us, John. I appreciate you.
Very fun. We appreciate it.